Leslie Thompson at the 2009 annual meeting of the American Society for Aesthetic Plastic Surgery, and I am here with Dr. Monte Eaves, who is the new president-elect of SAPS. Congratulations on your recent promotion there. And Dr. Eaves is a board-certified plastic surgeon, has been in practice for 15 years. Now, you also recently spearheaded an initiative with SAPS concerning patient safety, and I wanted to find out a little bit about that. Can you tell me about those efforts?
Well, this actually goes back a few years. The leadership of SAPS identified that obviously a key part to our mission has always been patient safety, but we really needed to coordinate the effort. There's so much going on within the whole field of medicine in this. So about 5 years ago, we established a separate committee structure specifically to focus and coordinate all the activities of the society. And it was wonderful because there was such buy-in from all the different commissions of the society, all the different areas. So we have had numerous projects to deal with all sorts of things in terms of patient selection, getting qualified physicians, improving issues in the OR and understanding of safety issues in the OR, things like the surgical pause initiative and so forth. So it's been very exciting to be involved with that.
That's excellent. Well, tell me a little bit about where you see SAPS going in the near future and perhaps even long term, and the role that SAPS plays in providing that education to patients and ensuring that they have the optimal experience.
Well, the core of our mission statement has always been education and patient safety, both to our members so that they can have all the tools they need to provide the best care, but also, making this information available to the public. A great example of how we've done this public in the past and are doing ongoing is the Injectable Patient Safety Coalition, where we partnered with dermatologists and facial plastic surgeons and core physicians in terms of educating the public about the safety involved with injectable treatments such as the botulinum toxins and fillers and so forth. And I think we're very proactive of that. We're also extending this reach around the world. We're working with the International Society of Aesthetic Plastic Surgery to share experiences and work in patient safety. And I think the other big trend going forward is really an emphasis on evidence-based medicine. I think it's a big trend throughout medicine that we're really starting to look at the quality of the studies and the research that's being done and demand very high levels. And then I think the final thing is really looking at a lot of the quality control measures that industry has been able to put in. We're really looking at this a multi-pronged approach, how to not only do the safest care, but also to give the best care, to really bring that wonderful blend of art and science that we pride so much within our specialty.
That's exciting. That's great. Well, one of the trends that I've witnessed recently in the realm of cosmetic surgery is a kind of marketing or branding that's happening with certain procedures. There's smart lipo and there's the lifestyle lift. As a prospective patient, what should someone look for? What can they believe when they see a magazine ad, a television commercial for a branded procedure? And is that necessarily credible versus just, the standard procedure or what they may speak to a surgeon about?
Well, I think certainly you have to take each individual thing on its own. And each stands or falls based on the science and the quality of the results. But the problem is that a lot of these claims are never substantiated, and they're driven by companies that have nothing but a profit motive. So I think the real problem is, as a patient, what do you believe? And I think what you have to do is you have to go to a qualified plastic surgeon and sit down and have an honest talk and be prepared to sit there and understand. A plastic surgeon can sit down and talk about what the options are, really educate them what their needs are. The real trend and the pitfall for patients is they're often enticed with these either very rapid recovery promises and very dramatic result promises that really may not make sense for that patient. Sometimes the tried and true, sometimes it may be a more extensive procedure, but that may be the safest and the best for them in the long run. So they really need to talk with someone that can give them all the options. Sometimes the problems we see with patients are if they're going to a provider that can't tell them all the options, for instance, could only tell them about non-surgical options, but can't really educate them on the surgical options, it really limits their perspective and understanding. And I think that's really the benefit to going to a plastic surgeon. We can tell them everything from injectables and lasers all the way up to the surgical procedures and everything in between, so they can customize what makes most sense for them.
Excellent. Well, Dr. Eaves, thank you so much for your time. We really appreciate having you.
Absolutely.
And thank you for joining us today. I'm Leslie Thompson for the Plastic Surgery Channel.